Hello. So today we are discussing a presentation, understanding psychological stress and coping in mental health. So, understanding psychological stress and coping in mental health. Today we're going to look at psychological stress and why it's so important in mental health care. Stress is something that everybody experiences, but for people with mental illness especially, conditions like psychosis, stress can have a much bigger impact. And as future nurses, understanding stress helps us to sort of recognise why the symptoms might worsen and why some people struggle more than others. We'll also look at coping strategies as well that support recovery and quite often reduce relapse time. So, sort of understanding psychological stress. Psychological stress happens when a person feels they don't have the ability or resources to cope with what's happening in their life. This could be emotional pressure, it could be physical exhaustion, or it could be both. For example, imagine someone dealing with poor sleep, financial worries, and relationship problems all at once. That can really build up and can be really overwhelming with their coping skills. Also, research has shown that stress can trigger psychotic symptoms in people who are already vulnerable. The vulnerability stress model helps explain this. Some people may have a genetic or biological risk, but stress from the environment can push them into illness. Stress hormones like cortisol also can affect thinking, emotions, and memory, making it harder for the person to cope. Long-term stress increases cortisol again, which destroys the neural network. Delusions and hallucinations are caused by impaired brain functioning, and trauma and other life misfortunes increases the risk of psychosis. Stress can come from many areas of life, not just one. Biological stress includes things like sleep problems or chemical imbalances in the brain. So lack of sleep alone can increase anxiety and confusion. Social stress includes stigma, unemployment or isolation. Being excluded or judged also can be extremely dissatisfying. Environmental stress may involve trauma, migration, living in crowded cities, or drug use such as cannabis. Cultural stress also happens when some symptoms are misunderstood or people delay seeking help due to beliefs or fear. And also finally, systematic stress includes inequality or lack of access to mental health services. Nurses must consider all these factors when assessing their patients. The role of stigma and discrimination. Stigma creates stress that doesn't go away. So, when people are judged or labelled because of mental illness, it can affect how they see themselves. This is called internalized stigma, where the person starts believing negative ideas, leading to low self-esteem and depression. Discrimination can limit access to jobs, housing and healthcare. For example, someone may avoid seeking help because they fear that they're being judged. This also increases stress and worsens recovery outcomes. As nurses, again, we play a vital role in challenging stigma, promoting dignity and creating safe, supporting environments for patients. Looking at coping strategies then, we've got coping strategy 1 is cognitive behavioural therapy, or shortened down or better known as CBT. So what CBT is, it's a talking therapy that helps people understand the link between thoughts, feelings and behaviours. For someone experiencing psychosis, CBT can help them question distressing thoughts or beliefs. For example, instead of automatically believing a voice is threatening, CBT helps the person develop coping responses. And also, CBT doesn't remove symptoms completely, but it does reduce the distress and improves the coping. It also helps with concentration, memory and problem solving. CBT works best alongside medication and support services and helps people feel more in control of their mental health in the long term. Coping strategy number 2, family and community support. So here support from the family and community is extremely important in recovery. Family therapy helps relatives understand mental illness, improve communication and reduce conflict. This lowers stress at home quite often and reduces relapse. Community support such as housing services, employment support and crisis teams help people live independently and safely. Early intervention teams also work with people early in illness, which improves their outcomes. Peer support is also powerful. Hearing from others with lived experiences creates hope and reminds people that they're not alone. Coping strategy 3, so we've got holistic and lifestyle approaches here. So holistic care, this is quite a relatively new approach, but it is becoming more and more common. It focuses on the whole person, not just symptoms. It includes physical health, emotional well-being, social support and cultural needs. Simple lifestyle changes such as better sleep routines, regular exercise and balanced nutrition can significantly reduce stress. Cultural beliefs and family involvement should always be respected as well. When people feel understood and supported, they're more likely to engage with the treatment. Holistic care also improves communication between healthcare teams and community services, leading to better long-term outcomes. Comparing effectiveness of coping strategies, no single coping strategy really works on its own. The best outcome happens when therapies like CBT are combined with social support and healthy lifestyle choices. Medication may stabilise the symptoms, but coping strategies help people manage stress and stay well. As nurses, our role includes encouraging these approaches, educating patients and families and helping people access the right support. A person-centred approach leads to far better recovery and quality of life. Thank you.